Coronavirus disease 2019, also known as COVID-19. Stress and coping. The outbreak of coronavirus disease 2019, also known as COVID-19, may be stressful for people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you, the people you care about, and your community stronger. Everyone reacts differently to a stressful situation. How you respond to the outbreak can depend on your background, the things that make you different from other people, and the community you live in. People who may respond more strongly to the stress of a crisis include older people and people with chronic diseases who are at higher risk for COVID-19, children and teens, people who are helping with the response to COVID-19, like doctors and other healthcare providers or first responders, people who have mental health conditions, including problems with substance abuse. Stress during an infectious disease outbreak can include fear and worry about your own health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. Need help? Know someone who does? If you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or feel like you want to harm yourself or others, call 911 or your local crisis hotline. People with pre existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. Taking care of yourself, your friends, and your family can help you cope with stress. Helping others cope with their stress can also make your community stronger. Resources are available on the Substance Abuse and Mental Health Services website. Visit the Substance Abuse and Mental Health Services Administration website at www.samhsa.gov or call the Disaster Distress Helpline at 1 800 985 5990 and TTY at 1 800 846 8517 or text Talk With Us to 66746 or visit the National Domestic Violence Hotline at www.thehotline.org or call 1 800 799 7233 or the TTY number 1 800 787 3224. Things you can do to support yourself. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well balanced meals. Exercise regularly. Get plenty of sleep. And avoid alcohol and drugs. Make time to unwind. Try to do some other activities you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. Reduce stress in yourself and others. Sharing the facts about COVID-19 and understanding the actual risk to yourself and people you care about can make an outbreak less stressful. When you share accurate information about COVID-19, you can help make people feel less stressed and allow you to connect with them. Learn more about taking care of your emotional health at the CDC website at www.cdc.gov. For parents, children and teens react, in part, on what they see from the adults around them. When parents and caregivers deal with COVID-19 calmly and confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. Not all children and teens respond to stress in the same way. Some common changes to watch for include excessive crying or irritation in younger children, returning to behaviors they have outgrown, for example, toileting accidents or bedwetting, excessive worry or sadness, unhealthy eating or sleeping habits, irritability and acting out behaviors in teens, poor school performance or avoiding school, difficulty with attention and concentration, avoidance of activities enjoyed in the past, unexplained headaches or body pain, use of alcohol, tobacco, or other drugs. There are many things you can do to support your child. Take time to talk with your child or teen about the COVID-19 outbreak. Answer questions and share facts about COVID-19 in a way that your child or teen can understand. Reassure your child or teen that they are safe. Let them know it is okay if they feel upset. Share with them how you deal with your own stress so that they can learn how to cope from you. Limit your family's exposure to news coverage of the event, including social media. Children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep up with regular routines. If schools are closed, create a schedule for learning activities and relaxing or fun activities. Be a role model. Take breaks. Get plenty of sleep, exercise, and eat well. Connect with your friends and family members. Learn more about helping children cope at the CDC website at www.cdc.gov/children in disasters. For responders, responding to COVID-19 can take an emotional toll on you. There are things you can do to reduce secondary traumatic stress, STS, reactions. Acknowledge that STS can impact anyone helping families after a traumatic event. Learn the symptoms including physical, fatigue and illness, and mental, fear, withdrawal, or guilt. Allow time for you and your family to recover from responding to the pandemic. Create a menu of personal self-care activities that you enjoy, such as spending time with friends and family, exercising, or reading a book. Take a break from media coverage of COVID-19. Ask for help if you feel overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and patients as you did before the outbreak. Learn more tips for taking care of yourself during emergency response at the CDC website at www.emergency.cdc.gov. www.cdc.gov/coping. For people who have been released from quarantine, being separated from others if a healthcare provider thinks you may have been exposed to COVID-19 can be stressful, even if you do not get sick. Everyone feels differently after coming out of quarantine. Some feelings include mixed emotions, including relief after quarantine, fear and worry about your own health and the health of your loved ones, stress from the experience of monitoring yourself or being monitored by others for signs and symptoms of COVID-19, sadness, anger, or frustration because friends or loved ones have unfounded fears of contracting the disease from contact with you, even though you have been determined not to be contagious. Guilt about not being able to perform normal work or parenting duties during quarantine. Other emotional or mental health changes. Children may also feel upset or have other strong emotions if they or someone they know has been released from quarantine. You can help your child cope. Learn more about helping children cope at the CDC website at www.cdc.gov/children in disasters.